I'd like to talk about menopause and perimenopause for a minute. A common trend that we see is that women in particular tend to focus on everyone else instead of caring for themselves. And by the time we reach our 40s or 50s, we start to present with different health issues. We have a tendency of thinking that we can just push our body beyond the limits that we have without any consequences, but that's just simply not true. The good news is it's not too late. When we give our bodies what they need and we take away what's harming them, our bodies have an innate ability to be able to repair and rebalance. This is an area that functional nutrition and functional medicine really shine. We focus on that balance. So things that might seem simple, like proper diet, sleep, stress management, movement, those all affect that delicate balance. The thing is that for most people, change doesn't come easy. And that's where health coaches come in, because we're trained to be able to help patients to not only understand what's going on in their own bodies, but we work with each patient as well as their provider to help them come up with a plan that's going to work best for them. So in this way, even though we obviously all will continue to age, we can do it and feel good in the process.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.